Welcome to the sixth session of the Healthy Heart, Healthy Life series. I'm Dr. Neelkant Karandikar, cardiologist, and I do non-invasive cardiac procedures like echo, stress test consultations at Heart Clinic near Mukunnagar, Pune, and Alpha Diagnostic Center, Tilak Road, Pune. I do interventional cardiology procedures like angiography, angioplasty, pacemakers at Ruby Hall Clinic, Sahyadri Hospital, and Dinanath Mangeshkar Hospital. I've been designated Honorary Professor Emeritus in Cardiology, that means professor for lifetime, at the BJ Government Medical College and Sassoon Hospitals, Pune. I'm also the first gold medalist of the Bombay, now Mumbai University, at the DM Cardiology examination. Today, we are going to talk about a very important subject of how to recognize ischemic heart disease. We have seen in earlier sessions that the heart pumps blood supplying oxygen and nutrients to every cell, nerve, muscle, and organ in our body. It sits in the chest between the lungs, slightly to the left of the center, protected by the rib cage. It is about the size of a clenched fist and weighs approximately 300 grams, just over half a packet of butter. Ischemic heart disease can be defined as a condition where the supply of oxygen carried by the coronary flow, that is, the coronary artery supplying blood to the heart, is inadequate to meet the demands of the heart. The Greek word isko means to hold back, and the Greek word haima means blood. So it is a condition with blood in which the blood is held back from the heart. The word ischemia was first used by Foucault in 1858. Let us look at some interesting points in history. The role of coronary arteries in nourishment of the heart was described by William Harvey in 1628, as early as that. William Heberden in 1768, almost 150 years later, described ischemic chest pain accurately and coined the term angina pectoris. Brunton in 1867, that is almost 100 years later, for the first time used amyl nitrite for the treatment of angina. So what is ischemia? Ischemia is reduced blood flow and oxygen in a part of the body. That is the general meaning of ischemia. And ischemic heart disease means decreased blood flow and oxygen to the heart muscle. Myocardial ischemia causes, most of the causes will cause inadequate blood supply to the heart. And the number one cause all over the world is atherosclerosis, about which we have had a full session. I think it was the third session. Also, there are some other causes which are much less common, like vasospasm, where the artery undergoes constriction, thrombosis, where a blood clot forms in the artery, and embolism, where a blood clot from another source, like a chamber in the heart, goes and sits into the coronary, blocking the blood flow. So this is a picture of the diseased artery where atherosclerosis has caused an obstruction, not enough blood can flow to the heart, and therefore ischemic heart disease results. Now, broadly, there are two types of ischemic heart disease. Broadly, there are several types which we will look at later, but broadly, first is the angina. Now, angina is where the blood flow is decreased and hypoxia or insufficient oxygen to a part of the heart. Now, suppose this branch has a block, say 90% block, then this area of the heart will have what is called as insufficient oxygen and there will be angina. Now, heart attack is the other extreme where the blood flow is totally cut off and that part of the heart will undergo cellular death. And it is shown here in black. Suppose this artery here is completely blocked, and then this area which it supplies will be completely devoid of blood flow and will therefore there will be cell death in that area. We have seen earlier that the coronary arteries are right and left, and these are the normal coronary arteries around 3 millimeter diameter. Now, if there is a blockage like this or obstruction like this, or what we call as stenosis also, here it looks like around 75% stenosis, then you get angina or ischemia. But if the artery is completely blocked, as is shown by the black bar here, then this entire area of the heart will become dead, and that will be a big, big heart attack. Now let us look at the clinical spectrum of ischemic heart disease. Ischemic heart disease is a Baharupia. It can manifest in several ways, but the broad and the common ways are stable angina, chest discomfort triggered by exertion and relieved by rest, unstable angina, this is a little progressed level, new or worsening chest pain which occurs even at rest, that is unstable angina. Then this is a technical term, STEMI, but it means a type of heart attack where there is a heart muscle injury without persistent ST elevation. So this may not completely involve the full thickness of the heart muscle. So the ST elevation, which is typical finding on an ECG in a heart attack patient, may not be seen in NSTEMI. Then there is STEMI, which is a full thickness myocardial infarction or heart attack, and the ECG shows the typical ST elevation. This is technical, let's not get into that. So two types of heart attacks, NSTEMI and STEMI, and this is the very dangerous variety. Silent ischemia, reduced blood flow without typical chest pain symptoms. This is common in elderly people and in diabetics. So heart attack or even ischemia both can occur without any complaints noticed by the patient. Heart failure and arrhythmias can also result from ischemia. Arrhythmias means irregular heart rhythm, and heart failure means inability of the heart to pump out enough blood. This is an actual picture of a heart, and this is the actual picture of a coronary artery. You can see the yellowish atherosclerotic deposits. So this is what is, most cases underlies angina or ischemia. And here is shown a blood clot, big blood clot, blocking the artery. And if this happens, then there is a heart attack. We are not discussing heart attack today. We'll discuss it in one of the subsequent sessions. But angina is something we'll discuss today. How does myocardial ischemia affect my body? You know, the ischemia can start from mild and go to severe. When it is mild, makes exercise and daily activities more difficult. When you exercise, like climbing stairs and all, then what happens is a person gets chest discomfort or chest pain. Symptoms become worse in cold weather or after meals. That is the slightly more severe type of ischemic heart disease. Then progressively less activity triggers chest pain or discomfort. So initially, a person was able to walk 5 kilometers, but now he gets chest discomfort after 1 kilometer only. That is progressively less activity triggers the chest pain, and this is another step in the progression of that ischemia. Climbing stairs or light effort may cause symptoms, and in severe cases, symptoms may occur even at rest. So there is a gradually increasing course of ischemic heart disease or angina. Now, this is an important slide. Recognition of coronary heart disease. Cardinal symptom, common symptom is chest pain, feeling of pressure, heaviness, or constriction in the chest, as if somebody is compressing your chest, pressure on the chest. This is very, very important to remember. Pressure, heaviness, or constriction. Then, number three, retrosternal location, but radiation to the neck, jaw, and upper extremities, especially on the left side, upper extremity, that is left arm or left forearm. Brought on by physical exertion, emotional stress, especially after a meal or exposure to cold weather, relieved by rest or sublingual nitroglycerin. Duration usually 2 to 5 minutes. If something comes just momentarily like this, comes and goes, that is not angina. It will come up gradually, stay for a little while, and then die down gradually when you rest. And maximum is 20 minutes. If it is more than 20 minutes, then it is usually a heart attack. So these are the areas where the chest discomfort occurs. Center of the chest, very common. It can go to the neck, sometimes to the jaw also. Then left side of the chest, left shoulder, inner aspect of the arm and left forearm. And less commonly to the right side and inner aspect of the right arm and forearm. This is less common. This is the most common. So it is called as chest pain and chest pain radiation. These arrows show the radiation where the chest pain can travel. Now, what is stable angina? Present for several weeks or months. No significant change in frequency, duration, severity, and effort tolerance. Coronary artery obstruction is present but not progressive. If some patient of mine were to come and tell me that, doctor, I get chest discomfort after climbing 3 flights of stairs, it stays for around 2 minutes, it is moderate in severity, and usually it comes after so much of exertion, that is 3 flights of stairs. And for the last 6 months, I'm noticing this discomfort, but it has remained the same in frequency, duration, severity, and in effort tolerance. Then this is the typical stable angina pectoris. Now, this slide is very important. What we have seen just now is the typical angina pectoris. In this, the pain is central, pressure or squeezing or gripping, heaviness or tightness. These are common descriptions of the pain. Pressure sensation, squeezing sensation, gripping sensation or heaviness or tightness in the chest. And it comes on with exertion or stress related, even emotional stress. And it is generally retrosternal behind the central bone of the chest. This is a high probability angina. This patient, this complaint is likely to mean that there is a high chance that this patient has ischemia. Now, if it is left-sided, not central, dull, aching, then there is a probability, but not very high. It's a moderate probability. If it is stabbing, as if somebody has taken a knife and stabbed you, then it is less likely to be ischemia. If it is on the right side, tearing, ripping, or burning, even less likely to be ischemia. And if it is sharp, fleeting, shifting, pleuritic means superficial and positional, then it is the chance of ischemia is low. This word positional I will explain. Positional means that if a person, say, turns on the left side and he gets pain, when he becomes straight and then there is no pain. Or if he raises his arm and there is pain, but when he brings down his arm, there is no pain. It is likely to be muscular pain and not ischemia. Pleuritic is the superficial, kind of discomfort, which is difficult to describe, but it is called pleuritic shifting. Sometimes left, sometimes right, sometimes in the arm, sometimes in the neck. Fleeting. Fleeting means suddenly comes and goes. And if it is sharp, you know, like somebody coming and pricking a needle on your chest, then the chance of ischemic heart disease is low. It is very important to know the kind of chest pain which signifies ischemia and where the probability of ischemia is high, and then less, and least or low probability of ischemia. So this kind of knowledge is very important, very, very important. I remember one of my patients who was a rich man, who is a rich man, in fact owns a hotel, and he started getting discomfort in the chest. He thought it is because of gases, and he thought maybe some sleep will help him. He slept for 2 3 hours. It was still there. Then he went for a swim. He thought the gases will come out with some exercise. Still it continued. Then he came to the hospital. By that time, a lot of his heart muscle was lost. So it is very important for every health conscious citizen to know what kind of pain denotes heart disease. So thank you for attending this sixth session. This is a preliminary session in ischemic heart disease. I'm going to have 3 more very interesting sessions on ischemic heart disease, and I look forward to meeting you there. And thank you very much for attending. If you have not subscribed yet to my channel, please do subscribe and also give me a thumbs up, which will encourage me in providing uh, better and better quality of knowledge to all of you. Thank you, and thank you very much.